out there. Do you think the CDC and others, for example, got the messaging wrong when it comes to breakthrough cases, people who are fully vaccinated but get COVID? Experts have repeatedly insisted that breakthrough cases are rare, almost dismissing fears. But would it have been better to give a more nuanced explanation about what to expect?
I think we all have to recognize that with 164 million people who are vaccinated, we should expect tens of thousands, perhaps, of breakthrough infections. But the most important thing is not the number of the breakthrough infections, but what happens here. Those breakthrough infections have mild illness. They are staying out of the hospital. They are not dying. And I think that that's the most important thing to understand. We have a massive number of people who are vaccinated, and those breakthrough infections tend to be mild and not severe.
But what about all the fully vaccinated people who get the breakthrough infection? Can they pass it on? Could they pass it on to their children? Could they pass the virus on to older people, especially more vulnerable people with underlying health conditions?
And that's exactly the point that we made in our guidance. So yes, they can with the Delta variant. And that was the reason that we changed our guidance last Tuesday. Our vaccines are working exceptionally well. They continue to work well for Delta with regard to severe illness and death. They prevent it. But what they can't do anymore is prevent transmission. So if you're going home to somebody who has not been vaccinated, to somebody who can't get vaccinated, somebody who might be immunosuppressed or a little bit frail, somebody who has comorbidities that put them at high risk, I would suggest you wear a mask in public indoor settings.
Especially if there is a breakthrough case, you get COVID, you're fully vaccinated, but you are totally asymptomatic, you could still pass on the virus to someone else. Is that right?
That's exactly right. And that's where our masking recommendation came from.
It's so important, these masks. We're learning the FDA could lay out a national strategy, Dr. Walensky, for COVID-19 booster shots in early September, just in a few weeks. What will this strategy look like? Who will be eligible for these boosters first? All of us who got 2 shots, we might need, after 5 or 6 months, a 3rd shot.
We're looking at those data carefully. Those data include looking at clinical cohorts, our clinical trials, cohorts from across the country, our essential workers, long-term care facilities, healthcare workers who are vaccinated early. And we're working closely with the FDA following those data, and we'll come up with a plan soon in September.
And do you think that before that will happen, the emergency use authorization for these vaccines will be changed to complete and full authorization?
That lies squarely with the FDA, but I know that they're working very hard in order to get that full approval, because I recognize that we all recognize that some people are waiting for that approval to get vaccinated.
So what we're seeing in Israel and Germany and the United Kingdom right now, people already starting or about to start getting these 3rd booster shots. We can brace for that. We should anticipate that happening in the next few weeks here in the United States. Is that right?
We're having conversations with those countries, and we're looking at the same data that they are looking at, and we are making our independent decisions, looking at the data they have, collaborating with the data we have, and we'll make those decisions in collaboration.